Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon to everyone. I'm Dr. Nor'Aishah Abu Bakar from Ministry of Health Malaysia, and I am also the head of organizing committee for this year World Patient Safety Day webinar 2021. Today I will be talking about Malaysian Patient Safety Goals 2.0, the new phase of patient safety in Malaysia. A little bit of introduction on patient safety in Malaysia. We started in 2003 when we established a Patient Safety Council Malaysia. And in 2012 we started the initiative to establish Malaysian patient safety goals, and one of the main intention is actually to answer the question, what is the status of patient safety in Malaysia? For example, how many medication error happen, how many wrong surgery happen, and what is the status of hand hygiene compliance. So we would like to know what is the answer to all these questions. So on the 24th of June, finally, Malaysian Patient Safety Goals was launched by Datuk Dr. Nor'Aishah Abdullah, our Director General of Health, during the first National Patient Safety Campaign. So 2013 was the historical moment for us, and Malaysia has become one of the few countries which has its own national patient safety goals used by all healthcare facilities throughout the nation. So I just would like to share some of the pictures during this historical moment, and we can see here that this is Datuk Dr. Nor'Aishah Abdullah together with the Deputy Director General, the late Datuk Dr. Jaindran, together with other stakeholders during the launching. And over here we can also see that the ceremony where we actually call upon all the state health directors to receive the first Mpsg report card in 2016. So patient safety goals has its own philosophy. First, do no harm, which is a very important principle in patient safety. And then patient safety shall be given prime importance in healthcare, and preventable adverse events should be avoided at all costs. And the patient safety goal is applicable to all public and private healthcare facilities, either in hospital as well as in clinics. The main objectives are to challenge and motivate healthcare organizations in Malaysia in improving patient safety, to outline key priority areas on patient safety requiring improvement, and to act as a singular benchmarking on patient safety in Malaysia. After 2013, what have we achieved so far? Surprisingly, Mpsg has become the in thing and branding on its own. It has ignited a massive interest on patient safety throughout the country, and created a significant impact in highlighting importance of patient safety, not just among the healthcare staff but also among patients. And Malaysia continuously make a solidarity effort to achieve Malaysian patient safety goals since then. And normally we will present the performance of the goals to the Patient Safety Council, chaired by the Director General of Health every year, and the report is also shared in our Patient Safety Council Malaysia website. In terms of the action taken, we take actions both at the national level under Ministry of Health, and also at facility level. So the action is not just at the top level but also at the bottom level. Right. I just would like to share with you the reporting of the Mpsg throughout the year from 2014 to 2020, and over here we can see that the hospital have achieved 100%, yeah, the Ministry of Health Hospital, military hospital, as well as the university hospital, yeah. Private hospital have not achieved 100%, but we can see that the trending is very positive, yeah. It shows improvement every year, yeah. In terms of the health clinic, unfortunately, it showed some decrease, yeah, in terms of reporting, but the dental clinic shows a very positive improvement from 36% to 98%, yeah, in 2020. Right, I just would like to share some of the performance, yeah, that we captured through our Malaysian patient safety goals in 2020. For example, we had 5 cases of wrong surgery, we had 70 cases of unintended retained foreign body, we had 35 cases of transcription error, and more than 3,000 cases reported on actual medication error, and 4,000 cases on patient 4 related to adult patient, and almost 700 pediatric patient, yeah, related to patient 4. Right. So what have we learned so far? Well, we have good reporting system from healthcare facilities, except for private clinics. The performance of some goals have shown improvement, especially when they with the existing program to achieve the goals. For example, when we have 5 moments of hand hygiene related to hand hygiene compliance, yeah, safe surgery checklist related to the safe surgery program to prevent wrong surgery and unintended retained foreign body. Yeah, so those are actually essential tools that actually make the program successful. Yeah. And then the sentinel or never events are still occurring, and some show increasing in numbers, probably because of improved reporting, yeah. And few goals are not suitable to be monitored at national level, but can be integrated as part of monitoring at facility level, yeah. For example, clinical governance, critical value notification for lab result, ventilator-associated pneumonia, and catheter-related bloodstream infection, yeah. So now what we are doing with patient safety goals 2.0, we are monitoring the priority areas or the key goals to actually show the status of patient safety at national level. Yeah. And so the selection of goals and KPI need to consider practicality for the facility, the usefulness for country improvement, and validity of the data sent. So why the Mpsg revision? First, it's already due for revision, yeah, after 8 years of implementation since 2013, yeah. And we also want to be in line with WHO plan, yeah, and we would like to be more focused on crucial safety issues. Yeah? So after several years of implementation, we realized that some goals are very minute, and that can be integrated as part of the program in the healthcare facilities, and we don't need to monitor at national level. Yeah, we also need to add more value on the methodology of the implementation, and then have a more valid and reliable data. These are the engagement sessions that we had before finalizing the Mpsg 2.0. So we started with a workshop in 2019, yeah, and after that we actually presented to the Patient Safety Council Malaysia, and we had few suggestions from them, and they actually wanted us to have more engagement session, especially with the private sector, yeah. And after we finalized everything, we presented again to the Patient Safety Council Malaysia, chaired by Director General of Health, Tan Sri Datuk Sri Dr. Nor'Aishah Abdullah, yeah. and finally it was approved. Yeah, so the one that I'm going to present is the final version of the Mpsg. Right. So these are the Mpsg 1.0, the original one, yeah, and the one that I have slash are the goals that been eliminated from the Mpsg 2.0, yeah. So we can see here that it has been reduced from 13 goals to 7 goals only for Mpsg 2.0. So this is the new Malaysian Patient Safety Goals 2.0. We can see here that hospitals only have 7 goals with 9 KPIs, and clinics have 4 goals with 4 KPIs. Yeah? And this is very much manageable and focus on important goals and indicators. So this is the Mpsg 2.0, yeah, with 7 goals, yeah, and you can see here that the goals actually involve infection prevention and control, physical safety, medication safety, transfusion safety, patient fall prevention, patient identification, incident reporting, and learning system, yeah, and we actually for some of the goals we actually have improvised in terms of the KPI to make it more meaningful, and instead of process indicator it become outcome indicator. Yeah, I will explain to you each goals, yeah, after this. Right, goal 1 is on infection prevention and control, and for this we have 2 KPIs. One is hand hygiene compliance rate, just like before, yeah, in Mpsg 1, and then the target is still the same, more or equal to 75% compliance rate at each audit, and audit needs to be conducted every 6 months, yeah. And KPI number 2, this is the new KPI, is on rate of catheter-associated bloodstream infection, or CAPC, and the target is less than 5 per 1,000 admission. Right. So this is just the details about the hand hygiene compliance rate, the definition, and the technical specification. Yeah. This is the details of catheter-associated bloodstream infection KPI, yeah, and I will define the inclusion criteria shortly, yeah. But the exclusion criteria, uh, one, cases from emergency department, clinic, or other outpatient services should not be included, yeah, and also cases previously identified at the hospital, cases from screening culture, cases with organism identified as contaminant, yeah, and secondary bloodstream infection, yeah, meaning it is related to an infection from another son, yeah. And basically we need to conduct a point prevalence survey for a period of 2 weeks, and should be once a year, and the target is less or equal to 5 per 1,000 admission. So this is actually the definition, yeah. So the inclusion criteria is this: lab confirmed bloodstream infection. It must be a catheter that was inserted for more than 48 hours, and it can be either central or peripheral catheter, and the catheter still inside when infection happened, or just being removed within 24 hours. And if the patient is admitted or transferred into a facility with catheter still in place, and the day of catheter insertion at the initial facility is considered as day 1. Yeah. Okay. Goal number 2 is surgical safety, which is related to the Safe Surgery, Safe Lives program. And the KPI number 3 is number of wrong surgery performed, and the target is 0 case. And another KPI is number of unintended retained surgical item with the target of 0 case. Right. So when we talk about wrong surgery, it includes wrong patient, wrong site or wrong site of surgery, and wrong procedure, yeah, and non-conformance between consent and procedure, or totally different procedure performed, yeah, and also wrong implant, yeah, and the inclusion criteria is all surgeries or procedure involving general or regional anesthesia in the OT. Yeah, and exclusion criteria are procedures or surgery performed outside the OT. KPI number 4 is number of unintended routine surgical item with the target of category 2 and 3 zero case. Yeah. So we actually came up with a new definition of unintended routine surgical item, and category 1 means surgical team was aware of the retained surgical item. However, the risk of retrieval is more than the risk of retention, and therefore the surgeon decided to leave the item in the patient. For example, broken drill bit in the bone. Yeah. And category 2 is the surgical team was aware of the count discrepancy or broken surgical item but unable to locate after thorough search according to the SOP. Yeah. And category 3 is the surgical team was not aware at all of the retained surgical item at the end of surgery. However, it was discovered after the patient present symptoms or accidentally detected. Yeah, so what we want to achieve is category 2 and category 3 should be zero case. Yeah. Goal number 3 is medication safety, and the KPI is number of medication error related to severe harm or death. Yeah, I will explain a little bit on the definition of severe harm. Yeah, and the target is actually zero case. Yeah, so there should not be any medication error that lead to severe harm or death. Yeah, and we also wants to collect more data related to medication error. Yeah. Right. So this is the actually category of medication error according to the medication error reporting system under pharmacy. Yeah. And over here we can see that there are various error outcome, which includes a potential error, error and no harm, error with harm, error with harm and death. Yeah. So what we are capturing for a medication error with severe harm or death are actually category F, G, H, and I. Yeah. So this is what we want to achieve. There should not be any medication error that lead to harm or death. Right. The next goal is goal 4 on transfusion safety, and the KPI is the number of incorrect blood component transfused, and the target is 0 as well. Yeah, and we also want to collect a little bit more information so that we can calculate the rate. Yeah, and also a number of near miss. The next goal is goal 5, which is fall prevention, and the KPI is to reduce rate of patient fall uh, for inpatient and also outpatient. Yeah, and the target is less or equal to 5 per 1,000 patient days, and for outpatient and primary healthcare facilities, it is less or equal to 5%. So the definition of patient fall is unintentional descent to a lower level with or without injury, witness or unwitnessed within a healthcare facility. And the exclusion criteria are unpreventable fall due to events such as seizure, loss of consciousness, paralysis, cardiac arrest or external forces, as well as fall when the infant or toddler is learning to walk. Yeah, Okay, the formula is total number of falls divided by total number of patient days in the facility times 1000. Yeah, and then you will get the falls rate per 1000 patient days. And for outpatient and primary healthcare facility is quite straightforward. It's the total number of falls divided by the total number of clinic attendance, yeah, times 100, and you will get the falls rate for clinics, yeah. And the target is 5 per 1000 patient days or less for inpatient and 5% or less for outpatient. Goal number 6 is correct patient identification, and the KPI is number of incidents caused by wrong patient identification, and this is detected by incident investigation. If you can recall previously, correct patient identification, the KPI is a little bit different. We actually did audit, yeah, it's similar to hand hygiene compliance audit, yeah, and to see whether there is a compliance to dual identifier, yeah. But we found out that there are so many biases, and sometimes when people know that they are being monitored, then their practice is different, yeah. So we change from process indicator to outcome indicator, yeah. And I just would like to highlight again the use of two identifiers when identifying patients, include the IC number or the passport number, the full name, and the registration number. So we need to use at least two identifiers when identifying patient for the purpose of, for example, giving medication or taking blood or blood transfusion, yeah. Final goal is goal number 7, incident reporting and learning system, and the KPI is patient safety incident reporting system being established, and the target is utilization of the system to improve patient safety and prevent similar incidents. Yeah, so there are a few additional data that we will also like to gather, such as the total number of patient safety incidents done, yeah, and total number of incidents that lead to severe or death outcome, and then total number of incidents with severe or death outcome that were investigated and action taken. Yeah, so we want a little bit more detail on this. Yeah. So in summary, Malaysian Patient Safety Goals 2.0 is much simpler and practical. We have 7 goals for hospitals and 4 goals for clinics. It indicates status of patient safety in Malaysia, and it is also useful for not just national improvement but also the healthcare facility improvement. Before I end my presentation, I would like to inform everyone that tonight, Prime Minister's office will be lit up in orange as a symbol of solidarity to patient safety. And every year, Malaysia will be joining the rest of the world in lighting up important monuments and buildings in orange as a symbol of our commitment and solidarity in patient safety. Yeah, so please do visit Putrajaya. And last year we actually managed to highlight the whole Putrajaya city in orange, and the year before KL Tower in orange. So please take care everyone and stay safe. Bye.